Welcome back, everyone. Today is an absolutely huge day. We are finally wrapping up our massive Healthcare Reimbursement Explainer series with Part 14, OWCP Claims Processing, and the Payer Landscape finale. Now, if you've ever handled Department of Labor Office of Workers' Compensation Programs claims, you already know they are in a complete league of their own. Today, we're breaking down the exact step-by-step protocols you need to get these incredibly complex claims paid.
All right, let's take a quick look at our roadmap for today. We're covering Introduction and Enrollment, the Verification Checklist, the Accepted Diagnosis Rule, Prior Authorization, Adjudication Mechanics, and then we'll wrap it all up with our course finale on the Payer Landscape. Let's jump right in.
Starting right off with Section 1, Introduction and Provider Enrollment. We've got to look at the baseline mandates first.
Okay, so we're dealing with some seriously specialized rules here, guys. The operational protocols governing the Office of Workers' Compensation Programs, or the OWCP, for federal workers are totally unique. They are completely distinct from your standard commercial or Medicare claims. You see, the OWCP, which is part of the U.S. Department of Labor, manages disability compensation specifically for federal workers who get hurt on the job or develop occupational diseases. And let me tell you, these claims are notoriously complex. You're not just billing for a routine checkup. The coding and documentation you submit literally decides whether an injured federal employee gets their rightful compensation. The stakes are absolutely as high as they get.
Because of that, before you even think about billing the Department of Labor, there is a super strict sequence you have to follow. Step 1, formally enroll your practice with the Department of Labor. Step 2, obtain an official DOL provider number. And Step 3, only then can you actually file claims. You absolutely must mandate that your healthcare providers formally enroll and secure that specific DOL provider number before a single claim goes out the door. If you skip this, boom, instant rejection, no exceptions.
Moving right along to Section 2, the front-end verification checklist. These are your essential front-end checks.
Look, before treating any patient who walks in presenting with an occupational injury, you've got to run through this exact verification checklist. And you need to verify these details directly with the patient's employer or the workers' comp insurance carrier. Please, do not just take the patient's word for it. You must confirm the official claim number, verify the exact date of injury, and confirm the specific authorized body part. You also absolutely need to get the claims adjuster's full name and direct contact details. And lastly, verify the exact claims mailing address. I promise you, getting just one of these wrong on the front end guarantees a massive, massive headache on the back end.
What's really wild here is just how incredibly granular you need to be to protect your revenue. I really want to stress the importance of confirming the specific anatomical body part authorized for treatment. For example, if the authorization clearly says left shoulder, and you bill for a generalized exam or, heaven forbid, the right shoulder, expect an instant denial. On top of that, getting the adjuster's direct phone number is vital. Having a direct line to the actual human being managing that file is hands down the best way to resolve administrative hiccups and avoid those instant denials.
All right, Section 3, the Accepted Diagnosis Rule and Medical Necessity.
So there is a super strict single or maybe dual diagnosis restriction in play for these claims. Let's say you have an accepted reimbursable condition, right? Like an injured shoulder from a warehouse accident. If that same worker comes into your clinic and also happens to complain about developing bronchitis, you absolutely cannot bill that bronchitis treatment under the workers' comp claim. It is entirely unrelated to the occupational injury. It just doesn't fly. Bottom line, every single reported procedure has to be justified exclusively by the officially sanctioned diagnoses. Workers' comp carriers usually only recognize one or two very specific diagnosis codes approved for that exact work-related condition. Uncompromisingly, deviating from those specific codes means zero compensation. It's really on the treating physician to be hyper-aware of these accepted diagnoses to make sure all the care provided is justified by that highly restrictive medical necessity.
Which brings us to Section 4, Mandatory Prior Authorization and Documentation Attachment.
You know you can't just provide a service to a federal worker and casually bill for it later, right? Every reportable operation requires explicit permission from the OWCP beforehand. I really want to deliver this stark risk warning directly to you. Although pre-certification does not ensure payment, failing to pre-certify assures no payment. This right here is the golden pre-authorization rule of OWCP billing. Every single claim has to be pre-authorized. Skipping this step doesn't just delay things. The severe financial consequence is a rock-solid guarantee of zero payment. Please, do not skip this.
But wait, authorization is really only half the battle. It is absolutely mandatory to attach comprehensive medical records proving a direct linkage to the accident. Every single submitted claim has to be accompanied by detailed medical documents. You literally have to definitively prove that the medical care you are billing for is directly related to the specific workplace accident that occurred. If your clinical notes do not explicitly link the treatment to the occupational injury, the claim is going to fail. Simple as that.
Let's pivot to Section 5, Adjudication Mechanics, the DOL fee schedule, and mandatory EFT. Let's peek at how the back end actually processes these things.
What's really unique here is how the government combines rule sets to adjudicate claims. The OWCP uses the official Department of Labor fee schedule, but, and here's the kicker, they process those alongside National Correct Coding Initiative, or CCI, edits. So your coding must be flawlessly clean. And as for getting paid, payment distributions are issued exclusively through mandatory electronic funds transfer. No paper checks floating around here.
So how does that actually impact your setup? Well, it's a strict 3-step sequence. Step 1, provider registration. Step 2, mandatory EFT enrollment. Step 3, DOL claim submission. I really have to remind all billers that mandatory EFT setup is a strict prerequisite. It absolutely has to be completed during that initial provider registration phase, way before any DOL claims are ever submitted to the system.
Time for a quick reality check, folks. You are going to have to navigate a massive bureaucratic tangle with frequent administrative follow-up. That is just the nature of government claim workflows. You're dealing with a gigantic federal system. Consistent, persistent follow-up is literally the only way to ensure these specialized claims don't get lost in the system and that your practice actually gets the compensation it earned.
And finally, Section 6, Summary and Course Finale. Let's zoom out and look at the entire payer landscape one last time. Wow, what a journey this explainer series has been. Let's do a sweeping, authoritative review of the diverse payer systems you've completely mastered over these past episodes. You've navigated the intricate webs of commercial networks, deciphering PPOs, HMOs, and high-deductible plans. You learned to meet the chief government payer, Medicare, breaking down Parts A through D and those tricky supplemental policies. We explored Medicaid, managing state-run programs and complex patient spend-downs. We tackled military and veteran networks through TRICARE and CHAMPUS. And finally, today, you conquered the highly restrictive, specialized world of Department of Labor workers' compensation. You now truly have the coding agility to handle absolutely any payer that comes your way.
You have put in the serious work to master this landscape, and you are ready to tackle the real world of medical billing with absolute confidence. But here's a thought to leave you with. As automation and AI begin to handle more of these rigid government edits, how do you think the role of the human medical coder will evolve in the next 5 years? It's definitely something to ponder as you submit your next batch of claims. Like, share, subscribe to Decode Healthcare with Harshal.